on Dr. Osborne's Zone. You unlock this door with the beef jerky, magnesium, school lunches, killing our children, and more today on Dr. Osborne's Zone. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over to Dr. Osborne's Zone. Welcome to Dr. Osborne's Zone. Today we're going to talk about 7 reasons you need to take magnesium. So let's dive in. You see here we've got a summary of these: muscle tightness, migraine headaches, PMS, heart palpitations, high blood pressure, bone loss, depression. We're going to go through those today, so stick with me. Before we dive in to that bulk, though, I'd like to just kind of do an overview of what you should know about the importance of magnesium. It's responsible for hundreds of different chemical reactions in the body and arguably one of the most well-studied nutrients. And so a deficiency of this particular mineral is not something that you want to find yourself face-to-face with. Now you can see here in this review study published in 2020, in humans, subclinical. What does that mean, subclinical? Let's stop there. Subclinical means it is a deficiency that presents before major disease sets in. Subclinical means, again, almost like early kind of pre-disease, if you will. So subclinical magnesium deficiency is common and generates chronic inflammation. Keyword, magnesium deficiency causes chronic inflammation. So, which is the common denominator of a wide range of mental and physical health problems, from metabolic disease to cognitive impairment, from bone loss or osteopenia and sarcopenia, which is muscle loss, to depression. It is ascertained that magnesium content in fruits and vegetables dropped in the last 50 years, and about 80% of this nutrient is lost during food processing. As a consequence, a large percentage of people all over the world do not meet the minimum daily magnesium requirement. Again, so fruit and vegetable content of magnesium is dramatically reduced because of over farming and over soil utilization and over nitrogen fertilizer utilization. So the soil has been depleted, the topsoil has not been replenished and regenerated, and so our foods don't contain as much. But then processing causes major loss of magnesium in the food that we eat. We also have this other problem. Now in the United States, and this is true of most industrial countries, something called polypharmacy has become the norm. The average American over the age of 50 is generally on 4 or more different types of medications. That's polypharmacy, multiple medications being prescribed to the same person. So what you see in this research article published on magnesium and drugs says several drugs, including diuretics. So if you're taking, what is this? This is if you're taking blood pressure meds, right? So if you've got diuretics for blood pressure, that would include things like the loop diuretics or thiazide diuretics, and then proton pump inhibitors. So if you're blocking acid, right? If you're blocking acid with your diet, there'd be drugs like Nexium or Zantac or Tagamet, okay? Can cause magnesium loss and hypomagnesemia. And so that being the case, magnesium and drugs use the same transport and metabolism pathways in the body for their intestinal absorption, metabolism, and elimination. This means that when one or more drug is taken, there's always a potential risk of interaction with the magnesium status. Given the ever-increasing number of drugs on the market and the frequency with which they are used, greater attention must be paid in daily medical and pharmaceutical practice, focused in particular on the adverse effects of drug therapy on magnesium status in order to minimize the potential risk to the health of patients. Now, how many of you have ever answer this question, if your doctor has said, you know what, I've got you on multiple medications, let's put you on magnesium, or let's check your magnesium levels. How many has that ever happened to? If you've had that happen, chime into the comments. Now let's look at this other summary here on the importance of magnesium in healthcare. You can see here level 1 evidence supports the use of magnesium in the prevention and treatment. So this is what's interesting about this wording, is not just prevention. You know, because by FDA law, they always make you put the disclaimer that says this supplement is not intended to treat, cure, or diagnose any kind of diseases. Only drugs can do that because pharmacy has a stranglehold on everything. But you can see here what this author, or what these authors say, is that magnesium, there's evidence that magnesium can be used in treatment of many common health conditions, including migraine headache, metabolic syndrome, diabetes, hyperlipidemia, which is high fat in the blood, asthma, premenstrual syndrome, preeclampsia, which is a high blood pressure in pregnancy, and various cardiac arrhythmias. Magnesium may also be considered for prevention of renal stones, renal calculi, and cataract formation as an adjunct or treatment for depression, and as a therapeutic intervention for many other health-related disorders in clinical practice. Optimizing magnesium status through diet and supplementation appears to be a safe, useful, and well-documented therapy for several medical conditions. Now again, this is a review summary. Let's dive into now the individual 7 that we said we were going to talk about. Now, number 1 is muscle tightness. And really, it's not even just tightness, it's also muscle cramps. So many people with magnesium deficiency will also experience cramping, but it doesn't have to be a cramp. And so that's what I want to touch base on, because you can be woken up, you're lying in bed and your feet start to cramp and you have to jump out of bed, but that happens to a lot of people. But you could also just have generalized muscle tightness or stiffness. And this is where you have kind of a subclinical low-grade magnesium deficiency that just prevents your muscles from being able to contract and relax effectively. And so the muscles get tighter and tighter and tighter. And tight muscles lead to compression of joints. And this is one of the hallmarks of how arthritis can set in, because when you have compressed joints, you get more friction, more wear and tear, and you can get what doctors like to call osteoarthritis, or age-related onset of arthritis can start to set in. And so magnesium keeps the muscles, let's just think of it, it keeps them lucid and loose and allows them to contract and relax appropriately. This is one of the reasons why people also will take magnesium when they're stressed, because stress causes tension in the muscles, and that magnesium can actually work as a muscle relaxer. Think of magnesium as nature's muscle relaxer. And so for that reason, if you're struggling with chronic tightness and cramping, you might want to consider having your magnesium levels checked and supplementing accordingly. Migraine headaches. Migraine headaches affect so many people, and in my experience, the predominance of who migraine affects is women. And so migraines can be very debilitating, from a prodrome to photophobia or light sensitivity to just severe pain that debilitates a person and puts them in bed for 10 hours, 12 hours, 2 days, depending on the level of the headache. But magnesium has long been used as a migraine prophylactic. And so a lot of migraine formulas actually contain magnesium for that very reason. Now, there's multiple triggers for migraine. Stress can be a trigger, tight muscles can be a trigger, food can be a trigger, chemicals can be a trigger. And so what a lot of times will happen is the muscles are too tight, and then a person gets exposed to a food. And so you got 2 of those triggers working together, and then a migraine starts to set in. And that's why sometimes just taking that magnesium to loosen the muscles around the neck and head and occiput can lead to a reduced, might help if I spell muscles right, a reduced migraine intensity, but also a reduced migraine duration. And so a lot of people will take magnesium at the first sign or the onset of a migraine headache in order to reduce the potential for it to blossom into something that keeps them in bed for days. Now, my experience, anywhere from 400 to 1,000 milligrams as far as magnesium, and good quality magnesium. And there are a lot of different types. There's citrate, there's malate, there's bisglycinate. The one I wouldn't recommend, one of the types of magnesium that I would say is a poor form and poorly bioavailable and poorly absorbable is magnesium oxide. But any of your crab amino acid chelates like citrate, malate, glycinate, etc., can be effective. And so using those at the early onset of something can be very, very beneficial and helpful. Okay, PMS, premenstrual syndrome, and this is especially true if your PMS is leading to a lot of depression. The PMS aspect, the depression aspect, magnesium is very, very important for methylation, which, you know, many of you may understand methylation as you've been taught as a form of, in a sense, of detoxification. But methylation is a very, very important role, and one of the biggest roles that it plays is in the production of neurochemicals or neurotransmitters. And these neurotransmitters, such as serotonin and dopamine, play a major role in mood and how a person feels. And so it's very, very important that if you struggle with depression, especially around your cycle, again, ask your doctor to measure your magnesium levels, not your serum magnesium levels. Most doctors do have the ability to measure magnesium in the red blood cells. So this is actually one way that it can be measured. In my opinion, it's not the best way to measure it. It's best to measure it using a technology called lymphocyte proliferation. In my experience anyway, most doctors, when patients come back to me, they say, my doctor never heard of that, lymphocyte proliferation. And so most doctors can run red blood cell magnesium. So again, if you're a female struggling with depression or other premenstrual symptoms, you might want to consider looking at magnesium. Okay, heart palpitations. This is another big symptom. Heart palpitation. Remember what magnesium is? It's an electrolyte. So it helps with the relaxation and contraction of muscle, but also it helps with the impulse of nerve transmission. And so your heart being a muscle and a major bundle of nerves, without having adequate magnesium, it's very, very common to see people have heart palpitations. And I get this all the time. People go get an EKG and they have abnormal EKG, and they get an EKG because they're having heart palpitations, and their doctor wants to put them on usually polypharmacy, right? Multiple medications to slow down their heart or to slow down their pulse, or whatever it might be, and not measuring magnesium. As a matter of fact, again, another question for you. How many of you have had your doctor say heart palpitations or arrhythmias could be caused as a result of magnesium deficiency? Before we put you on a bunch of drugs, maybe we ought to check your magnesium. It doesn't happen. I haven't seen it. I've yet to see in over 21 years of practice, I haven't seen it happen where somebody's come to me and said, yeah, my cardiologist wanted to look at my magnesium because it was having this, and I'm always the one that ends up having to check it. So if you're having that type of problem, remember, just like magnesium deficiency can cause tight muscles, your heart's a muscle too. It can cause dysfunction in the way the rhythm and the rhythmic beating of the heart. Magnesium deficiency can increase your blood pressure. As a matter of fact, and what we talked about earlier with preeclampsia, which is high blood pressure during pregnancy, one of the hospital treatments is magnesium IV. That's one of the ways they try to get this under control. But blood pressure problems, and this is what's interesting about this is, so you have hypertension. What happens? The doctor prescribes a diuretic. Diuretic causes lowered magnesium, but not just magnesium, but also like vitamin B1. It can reduce, a lot of the diuretics they're not potassium sparing, so they'll cause potassium loss, they'll cause calcium loss. And then what ends up happening is these nutrients, the reason I list these particular ones out is that deficiency in these nutrients, what does that lead to? It leads to high blood pressure, right? So here we have, again, let's just say your blood pressure is high because you have a magnesium deficiency, which led to that high blood pressure. So your doctor put you on the diuretic, which caused these things that's led to more high blood pressure. And now you get stuck on another blood pressure medicine, because that's usually they start people on diuretics and then they use other drugs like ACE inhibitors and angiotensin receptor blockers and beta blockers. and then those all come to play, and a lot of those drugs will cause CoQ10 deficiency, and unfortunately CoQ10 deficiency also causes hypertension. So this is why polypharmacy is like guaranteed if you have high blood pressure and you don't know what your nutrition is, because as you take those different medicines for blood pressure, you almost inevitably will end up with deficiencies that will, create a negative feedback loop, causing the very same disease that your doctor's trying to treat with the medication. But know that magnesium deficiency is a contributor to high blood pressure, because again, if you have it and don't know why, something you would want to ask your doctor to check. We also have bone loss, right? Bone loss is a major element for those who deal with gluten sensitivity or have celiac disease. We know that osteoporosis is a hallmark outcome because of the malnourishment, because of the malabsorption. And so bone loss oftentimes will be diagnosed using a bone scan, which is not the best way to diagnose bone loss, by the way. And you can watch my video. We've got a video on bone scan myths if you'd like to check that out. But this is the number one way it gets diagnosed. All right, very rarely does osteoporosis get diagnosed with somebody actually having a compression fracture in their spine or a fracture in the hip or something along that line. But so again, my point being that, there's some problems with diagnosing bone loss using a bone scan as a sole factor for making that determination. I would simply say this: magnesium deficiency can contribute to bone loss because it plays a role in the mineralization of your bone. And so your bone, a lot of doctors will say take calcium, and you may need calcium, but magnesium is important for bone, as are many other minerals, and as is protein. And so inadequate magnesium can really contribute to the loss of bone and the onset of osteopenia and osteoporosis. And so remember, this is a lot of times that polypharmacy, it starts here, right? The diuretic for the blood pressure leads to the deficiency. Calcium you see there, magnesium you see there. A few years later, doctor wants to do a bone scan. Here we are. Oh, you have bone loss, and then what do they want to do? They want to put you on, these drugs, these bisphosphonate drugs that basically increase the mineral calcium. They increase the calcium or the deposition of calcium into the bone. And so what that does, it doesn't make a bone stronger, it just makes a bone appear less osteoporotic on a bone scan. But these drugs actually, when you take them, as they force all that calcium into the bone, they make them more brittle, and they increase the risk for something called osteonecrosis, which, if it happens in your jaw, you can lose your ability to chew, and now you're going to become severely malnourished. And how are you going to get your magnesium if you can't eat your food? So you got to be careful for that one too. Now let's look at this next one. This is depression. Magnesium plays a role, as we said earlier, in the production of neurotransmitters like serotonin and dopamine, and it also plays a role in the breakdown of epinephrine, norepinephrine, and the metabolism of those particular neurotransmitters. All of those are very, very important for mood and how a person feels. And there have been a number of research studies that have shown that the supplementation with magnesium can effectively help with depression, as we mentioned earlier, with premenstrual depression, but also can help with non-premenstrual depression as well as postpartum depression. So let's kind of summarize what research has to say about magnesium. You can see magnesium, when decreased in the food chain, which I showed you earlier, that we've got much less density of magnesium in our fruits and vegetables today. So we have a reduction in the food chain, which leads to a reduction in intake. And we know that a couple different things happen. One is chronic inflammation, the other is oxidative stress. And it's these two primary mechanisms that can contribute to lack of bone, diabetic tendencies, because of the insulin sensitivity aspect and the breaking down of glucose. We know it can cause neurological and psychiatric disorders such as depression. We know it can cause heart diseases, not just arrhythmias, but heart diseases like ischemic heart disease and stroke, which is a cardiovascular disease of the brain, and then skeletal and muscle mass. So it can cause a loss of muscle mass or osteopenia, osteopenia for skeleton, and then sarcopenia for muscle. And so again, those are some of the primary takeaways. Now over here, we know that these are studies that have been done that show the importance of magnesium when it's low. And so you can see magnesium deficiency increases the risk of arrhythmia in the heart. It increases the risk of digoxin toxicity, which is a drug oftentimes used to treat people, heart disease. A risk of coronary artery disease, increases mortality and morbidity in patients with heart failure, increases mortality and morbidity post an ischemic event, and in the kidneys in patients with kidney disease. It increases the risk of osteoporosis, increases the risk of cardiovascular morbidity and mortality, and as far as bones, it increases the risk, as we mentioned, of osteoporosis for several reasons. One, because magnesium helps form bone. Two, because it reduces the vascular supply to the bone, increases inflammatory cytokines that break down bone prematurely, reduces the secretion of the hormone parathyroid hormone. So there's all these mechanisms, again, that magnesium plays a role in that can lead to or contribute to osteoporosis. And then here you can see magnesium deficiency increase the risk of migraine, increase the risk of seizure, increase the risk of stroke, severity of chronic obstructive pulmonary diseases like asthma, and then pancreatic or pancreas and metabolism. It increases insulin resistance, increases the risk of diabetes and high cholesterol and high triglycerides, and increases oxidative stress. And then from a vascular perspective, increases the risk of high blood pressure as well as atherosclerosis. So again, these research studies, these reviews on magnesium succinctly kind of illustrate all the different symptoms associated with low magnesium. I gave you the top 7 that I really wanted you to focus on. And let's talk about how we can get more magnesium. So as I mentioned earlier, you definitely want to eat magnesium, and these are good food sources for magnesium. So any of your green leafy vegetables, including spinach, kale, chard greens, wild-caught cold water fish, as well as other meats. And you've got almonds, figs, cocoa, garlic, and pumpkin seeds are all good sources of magnesium. Now, all that being said, I've said earlier that food sources, plant-based sources of magnesium are lower today than they were 30 years ago, 50 years ago because of soil erosion and non-regenerative farming practices. And so this is the case for supplementation. In my opinion, many people should be supplementing with magnesium, but before you go hog wild taking 1,000+ milligrams of magnesium a day, really what you should be asking, every single one of you watching this should be asking your doctor, especially if you're on medications or you struggle with any of the symptoms that we talked about, to measure your magnesium levels and supplement accordingly. Because it's best to know that you need it, that you should be taking it, versus whether or not you're going to be getting it from food. I'm a fan of food over supplements, but you may have increased deficit for a variety of different unique reasons that are, part of your bubble of life, so to speak. If you're on multiple medications, many which can deplete magnesium, you definitely want to get it checked out and then supplement accordingly. Hey, so today we're going to be reviewing Brooklyn Biltong Original. This is a type of beef jerky, and one of the problems with beef jerkies traditionally is most of them contain some type of soy sauce, which is predominantly made from wheat or derived from wheat. So it's hard to find good beef jerky that's also gluten-free. So this one met the criteria. It's absolutely gluten-free. If we look at the ingredients, there are just a few whole food ingredients here. There's grass-fed beef, apple cider vinegar, salt, coriander, allspice, black pepper, and rosemary, and that's it. And it's made in the U.S., made in North Carolina. And so it definitely is gluten-free in that regard. But what does it taste like, right? Because one of the other problems with beef jerky is it can be super chewy and tough. And biltong is notorious for being a little bit more tough. So we're going to give this one a try and evaluate taste and texture. Took a minute. I mean, it is chewy. There's no doubt about it, but it's not the kind of chewy that you get with some jerkies where it's really hard on the teeth. So texture-wise, it's a softer chew. It does take a little bit to push through it, but the flavor comes out, the spices come out, and it's a real good flavor. It's a real good meat. So definitely we give it a thumbs up, a green light on the flavor. I give it a thumbs up on the texture for a jerky. Again, this is really easy to get down. It's not strangling me. And then number 3, it definitely gets a green check for being gluten-free. Now, calorie-wise, the other reason I picked this one was its nutritional value. So if we look at the nutrition facts panel, it's 1 ounce, which is 28 grams. There's eight servings in this particular bag here, is about 90 calories. But the bulk of those calories are protein. And so this to me is very, very important, especially, if you're trying to follow a balanced diet. It's really hard to get a jerky or, a lot of them have other additives and sugar additives. And so it brings the processed sugar carbohydrate content way up. This doesn't have that. So again, 16 grams of protein per 1 ounce serving. And then beyond that, it's got 3 grams of fat per 1 ounce serving and only 2 grams of carbohydrate. And I would imagine that's probably that carbohydrate is in that apple cider vinegar, which is where that's coming out. Now, the only thing I would actually say in the negative on this product and the way they could improve it and make it better, it's got grass-fed beef, which is perfect, but the ingredients, the apple cider vinegar and the other spices, are not organic. And I think this company could improve upon this product tremendously by offering either an organic option or certifying it by testing it for pesticides and offering a pesticide-free version. So whichever way, but that's what I would encourage them to do to make this product, 100% green light. Hey, if you have high blood pressure, you really want to pay attention to this next segment, especially if you're taking a diuretic. Now, there are a number of different types of diuretics, but 3 of the main types of diuretics, you might recognize the names. One is Lasix, another is the drug called furosemide, and then there's another class or type of diuretic called hydrochlorothiazide. And so these diuretics are medicines that are generally prescribed to treat people's high blood pressure, and the whole premise is that they increase urinary output. They reduce the quantity of water in your body. So by default, they're basically dehydrating you in an effort to lower your blood pressure. Now, why would doctors want to lower blood pressure? Because high blood pressure is one of the risk factors that increase the possibility that you could have a stroke or a heart attack. And so anytime somebody's blood pressure is high, again, the standard of care in this country is diuretics, one of the first arsenals out of the drug toolbox to be used to reduce volume of water content of the blood, which by default reduces blood pressure. Now, one of the side effects to using diuretics is as we lose that water, we also lose nutrients. Vitamins, minerals are also lost through the urine. Now, I'm going to put a research study up on the board for you, and what you can see here, this was a review published in the journal Nutrition Reviews. And so based on what they're saying here, you can read here, despite modern pharmacologic agents in the therapy of heart failure, the prevalence of heart failure is increasing worldwide. Now, I'm going to pause there. Despite using drugs to treat these risks, the prevalence of the diseases continue to increase, right? So what does that tell us empirically? It means that even though we're using all these drugs to reduce risk, the diseases continue to grow as time goes on. So what that tells us empirically is the drugs are not all that effective at really reducing risk. Now, there are doctors that would argue with the statement that I just made, but if the drugs worked, we wouldn't see as much of these problems, but the issues are we are seeing more of these problems despite the drugs. Now, these authors go on to say, in the vitamin B1 deficiency disease beriberi, okay, cardiac symptoms may represent the central feature. 2 new studies confirm that all diuretics lead to increased urinary thiamine. What does that mean? Let's make sense of that. All diuretics cause the increased excretion of the very important B vitamin thiamine, which is vitamin B1. Now, beriberi, which is a disease caused by vitamin B1 deficiency, looks like, in a clinic, symptomatically looks like congestive heart failure and high blood pressure. So think about this for a minute. You have high blood pressure. Your doctor prescribes you a diuretic. The diuretic causes vitamin B1 deficiency. Vitamin B1 deficiency causes congestive heart failure and causes your blood pressure to go up. How are you winning in that scenario? How many of you taking a diuretic have actually had a doctor say, because you're on this diuretic, we need to monitor your vitamin B1 levels to ensure that we're not creating a new problem that can look like the very problem we're trying to treat? Raise your hand. Comment below if your doctor has put you on a diuretic and offered to test your vitamin B1. And also comment below if you're on a diuretic and your doctor hasn't. I'd like to know. I'd like to hear from you. Now, I'm going to show you this other research study on the long-term diuretic therapy use in patients. And so in this particular study, they were measuring the homocysteine levels. Now, you've probably heard me talk about homocysteine before. It is a chemical that when your body makes too much of it can increase your risk for heart disease. It's an independent risk factor for heart attacks, for stroke, for diabetes, for cancer, and for osteoporosis. So not a chemical we want to have floating around in high quantities in our blood. Now, the only way to lower homocysteine is through B vitamins. And one of the most important B vitamins that helps lower homocysteine and keep it in balance is folate. And what the authors of this research study found is that chronic diuretic use is associated with a significant increase in elevations in homocysteine concentration, as well as a significant decrease in the quantity of folate inside of red blood cells. In essence, people on long-term diuretic therapies have a greater risk of developing folate deficiency and elevations in their homocysteine levels. Again, homocysteine causing an increased risk for heart disease, and the only way to really get it down is through B vitamins, and folate is one of the most important B vitamins to get it down. So now that's two B vitamins from two research studies that we know that diuretics can cause deficiencies of, and those deficiencies can increase your risk of developing the very same types of disease that your doctors are trying to treat with the medications. So, what's the takeaway here? If you're on diuretics, talk to your doctor about testing your B vitamin levels. You might as well ask him to test your mineral levels while he's at it, because these diuretics also could deplete magnesium and calcium and potassium and other very critical electrolytes that help your body regulate blood pressure. And so if you're on these drugs, your nutrient status should be being monitored, because these drugs damage your nutrient status and induce the very disease the drugs are targeted at treating. Much like we trust doctors, oftentimes when we have health issues and we go see our doctor and we generally get their advice, and hopefully it's good advice and it improves our health overall, we trust schools with our children's health, right? We trust schools with their education, and we trust them to a large extent with food, with feeding them. Many schools serve breakfast, all schools serve lunch. And so it begs the question, what exactly are our schools feeding our kids? And so what I'm going to show you today is a sample menu, and this is a sample menu from a local school district here in my hometown of Houston, Texas. And when we compare this type of menu to other schools across the country, we see things that are very similar. And so here, let's push this up onto the screen. So this is the month of October that we're looking at in this particular school. And so you can see they have different categories. They have a meat and meat alternative grain category, a fruit category, a vegetable category, a milk as a category, and then other as a category. And so I want to point out some of the things within these categories. Now the first is, if we look at Monday the 3rd as the meal menu plan, we have three options. We've got cheeseburger, we've got hamburger, and we've got pepperoni pizza. Now if we really analyze those, first of all, what kind of meat are we talking about? Is it real meat? Is it fake meat? Is it organic grass-fed meat? And the answer is it's probably just FDA-approved meat. But ultimately, the cheese on the cheeseburger is not real cheese. These are Kraft slices that are being put on the bread, and so you get processed cheese on the bread. And then you also get processed bread, which is, got synthetic vitamins added to it, because if you didn't add those vitamins, it would have such poor nutrient quality, it would actually create disease. This is what our kids are being fed at school. Now, if you look at the fruit category on this day, it's pineapple chunks, and really nothing really wrong with pineapple chunks, but the question is, why not organic pineapple chunks? Why feed kids food that is going to contain the potential pesticide poisons? And then we look at vegetables, and you can see here cucumber slices and steamed glazed carrots are the two options. Really no comment there. Either one of those are, I guess you could say, halfway decent. And then you get into the other category, which is the milk category. And I don't even know why school lunches would have milk as a primary category, other than that the vast majority of the world thinks that drinking the milk from a cow is somehow a necessity for kids to grow up strong and healthy. But in this case, you can see they get three options. It's 1% plain milk, and that, why not fat? We're still around the rhetoric of high-fat diets being problematic and contributing to heart disease, which has been proven to be false. So why are we still serving, a 1% type of milk to these kids at school? In addition, we give them the option of a skim chocolate milk. So again, here we're serving them low fat because we're concerned about their weight and their health. Yet at the same time, we're offering up chocolate milk as an alternative, which, as you know, is going to have corn syrup and other forms of sugar in it. And so that's not helping them. So why even offer it? If we're worried about their weight, let's just offer them something plain. As a whole, real, fresh, organic, grass-fed milk, as opposed to a 1% or a chocolate. And then we get into the other category. And the other category really kind of vexes me a little bit, because you look here, basically the other category are garnishes and condiments. And why is that even a category of food on the menu? So we have here ketchup, which, by the way, many schools get reimbursed with federal dollars because they serve ketchup, and ketchup gets classified as a vegetable in the school menu program, even though technically tomatoes are fruit, not a vegetable. They're classified as one. And so again, ketchup, what's the primary ingredient? Number one ingredient in most ketchups is fructose, high fructose corn syrup. The number two ingredient generally is a white vinegar derived from genetically modified corn. So again, how healthy is it actually? And then we have mayonnaise, mustard, pickles, and ranch dressing, all of which, or most of which, contain sugar, dyes, and other artificial preservatives and things like MSG. So again, this is what they're feeding our kids every day. Now, one might say, Dr. Osborne, this is a little bit overblown. You're blowing this out of the water too much. I don't think so. This is every day. Remember, kids eat 3 meals a day for the most part, and this is a third of their meals. And so let's just go through this menu. So Monday is cheeseburger, hamburger, or pizza. Then we get to Tuesday, and it's a beef taco or a turkey hot dog. And of course, a hot dog is going to be full of meat glue and processed MSG and other nonsense and garbage. And then we get to Wednesday, and we've got a chicken sandwich, which is a breaded chicken, fake chicken breast that's glued together with meat glue as well. Or we have meat glue breaded fish and with cheese and a roll. And then we get to Thursday, and we have chicken nuggets, which again is not real chicken. It's basically chicken parts that are glued together with meat glue or tissue transglutaminase, which is a bacterial byproduct. Or we get green chili cheese quesadilla. Not a lot of nutritional value in that either. And then we get beef crumble, macaroni and cheese with breadsticks, or a cheese calzone for Friday. So again, this is the week, and if we were assessing the nutritional value of these meals, we would find that they're not on par for protein, and that most of these meals are so high in carbohydrates and so low in protein and low in the right kinds of fat. So there's not any of the right kinds of fat that we need children to get, the omega-3s, for healthy brain development and for healthy IQ, which again, they're in school and we're trying to get them to be able to learn. And so again, this is just 1 week as an example. If you scroll through the month, we kind of see some repeats. We see cheeseburger, hamburger, pizza again, then we see chicken nachos on one day, and then we see cheesy breadstick bites as a meal on another day. We see Asian teriyaki chicken pop toppers with rice is another. Again, MSG, processed sugar, processed meat, lots of salt, right? All the wrong things. And when you add this up, if this is your child and they're going to school and this is a third of what they're eating on a daily basis, they're basically being carved to death with processed foods, and the meats that they're being offered and the proteins that they're being offered aren't organic, aren't grass-fed, contain high levels of omega-6, probably contain pesticides, and are an inadequate protein source for young growing bodies and young growing minds. So I challenge you, if you're watching this as parents, right? Get with your schools. Demand better. We spend an inordinate amount of tax dollars every year to fund public schoolhouses and to fund the cafeteria and the meal planning. And there are a number of research studies that show when you stop feeding them this swill and you switch the menus over to grass-fed, organic, whole, healthy foods, we get improvements in grades, we get reductions in disciplinary problems, we get improvements in IQs in our children. So why wouldn't we choose those things to feed them? Why would we choose anything any different? And the only way that this is going to change is if you make the phone call, is if you demand more out of your taxpayer dollars. Instead of demanding that all kids receive iPads, which they absolutely don't need, let's demand that we start with some general sustenance that fuels their minds and brains so that we can graduate them to a level where they're productive citizens with intelligent, free thought that can make the world a better place. That's a really good question. I think there's a lot of things that, you could ask 100 people and you'd probably get 100 different answers. But I think if I could snap my fingers and make the world a better place, it would be that nutrition would be solid in people's lives. If I could, again, there's no one magic, snap and just all pesticides disappear or, all sugar disappears. I think to snap my fingers for that to occur would be that people had great quality food without preservatives, pesticides, dyes, additives, and they had a high availability of nutrients. I think the world would become a very different place because food affects the mind in such a great degree. We look at a lot of people who are troubled today, a lot of the psychiatric disease, a lot of the excessive depression and anxiety that our society faces is a direct result of how they eat their food and what they eat in their food. And I think if we could make that change, those people would have such a better mental outlook. They would be so much more productive in their own minds and in their own lives because they wouldn't be battling and struggling with just a deteriorated brain and a deteriorated mind. So I think if I could snap my finger, it would be to make everybody have access to clean, solid, whole, real food. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this. And make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.